My name is Cindy Manginelli, and I'm with the National Healthcare for the Homeless Council. And I'm really excited to be partnering with the Tennessee Valley Coalition for the Homeless to talk to you today about street outreach in rural communities. And specifically, we're going to be talking about street outreach in regard to the COVID-19 pandemic and reaching out to our friends and neighbors who are homeless to make sure that they're doing okay, to give them supplies and resources and information that will help to keep them safe during the COVID-19 crisis. But a lot of what we're going to be talking about too will just be good foundational information for all those who would like to conduct street outreach, specifically in the rural environment. We're just going to be adding in some extra safety precautions and some extra conversation relevant to COVID-19. So when we think about street outreach, if you've never done this kind of work before, it's kind of a unique sort of service or unique sort of ministry. Street outreach, most of the information that you find about outreach would be written for an urban setting. I live just outside of Nashville, Tennessee, and when I conduct street outreach in downtown Nashville, I'm talking to people who are living in highly populated areas who have learned where to find food through community kitchens and through different agencies who serve those in need. They're very accustomed to having people talk to them or come up to them. They're usually accustomed to being approached by police officers or maybe different agencies and ministries. And so outreach among those who literally live on the street is very different than what we're going to be talking about today with those who live in a rural environment. And so, if you've never done this kind of work before, when we talk about people who are homeless, we talk about those who are sheltered and those who are unsheltered. People who are sheltered are living typically in some sort of homeless program in a homeless shelter, and that can look like a lot of different things. We're going to be talking about those who are unsheltered, people who are not sleeping in a place designed for human habitation, people who are not sleeping in a homeless shelter or in a church or doubling up with friends. We're talking about people who are really living more sort of out in the element, people living in camps, living in their car, living in abandoned homes or in abandoned RVs or mobile homes, people living in all kinds of situations like that. That's really what we're talking about. And in the rural setting, we're talking about people who may be way outside of populated areas. Even in some rural areas, you may have sort of a town square that's 1 or 2 blocks or 7 or 8 blocks. You may have people that are, living in abandoned buildings, but still in a more rural setting where there aren't a lot of resources and where there's a fairly low population. So, as we do this kind of work, we could talk a whole lot about the different reasons for homelessness, and I don't want to do that today. That's a different training. But I do just want to sort of touch the surface of why would someone live like this? Because if you don't have a good understanding of that, it may really affect how and why you do outreach. If really deep down inside you think, why don't they just get a job? Why don't you just go find an apartment? Then that's going to affect sort of the attitude and the mindset from which you do outreach. So, why in the world would someone choose to live like that? Why would you live in your car? Why would you live in an abandoned barn? And there are 1,000 different reasons. The number one reason why people experience homelessness is poverty. It's really important to realize that. Um, when you think about the person on the side of the road who appears to be intoxicated, who's holding a cardboard sign, that sort of classic view of the homeless person represents about 5% of people who are homeless. Most people who are homeless don't live like that. They're not homeless because they're of substance abuse. They're not homeless because of mental illness. The number one reason why people are homeless is because they couldn't pay their bills. And so you can think of all the reasons why that might happen. And coupled with that is that they don't have a support system. The inability to pay your bills, coupled with no support system, no one to call, no one who can help. And you can think, of course, of lots of different reasons why that would be the case too. When we think specifically of rural homelessness, a lot of the people that we will encounter, apart from those who couldn't pay their bills, apart from those who are just homeless temporarily because they've come across hard times, there are people in rural communities who are homeless seasonally because they only have work certain times of the year, or maybe they only have work depending upon different environmental factors. So you encounter people who are homeless, who've never been homeless before, will never be homeless again. You encounter people who are just in and out of homelessness, and then there are people who are homeless who just want to live alone. I was doing street outreach, and I was with an outreach worker, and we drove way out into a wooded area, and this young man emerged. He was expecting us. He got in the car, and he looked like he was walking straight out of an Eddie Bauer catalog. Immaculately dressed, really cool gear. And I just thought, wow, why is this guy homeless? And he had explained to the outreach worker that he'd been in the Marine Corps for many years. And in a freak accident, he shot one of his fellow Marines. And he decided right then and there, I will never live with people again. I can't be trusted. I'm dangerous. He ran away. He was AWOL. Um, and so he lived in camps. He still maintained a lot of the standard of living that he had learned in the Marine Corps. I've encountered many people living in unsheltered situations because they just didn't want to be with people for a lot of different reasons. And so there's no one reason why someone may be living this way, and there's no one solution. Some of the people that you encounter will not be homeless this time next week. They will very quickly, they've encountered a situation where they're homeless, and they will very quickly come out of that situation, and they'll never be homeless again. Some of the people that you meet will be homeless for the next 50 years, will be chronically homeless. And so there's no pat answer, there's no pat explanation. You have to be really careful when you're doing this kind of work that you don't put everyone into a box and assume that you know their story and assume that you know the solution. So that's why, who are the people you're going to encounter? You're going to encounter people of all different ages. You will encounter people who are teenagers who've run away from home, who've aged out of the foster care system. You will encounter people who are elderly, who are in their 80s. You will encounter people of all different races, all different backgrounds. You'll encounter people who grew up very wealthy. You'll encounter people who grew up in the foster care system. You'll encounter people who've been CEOs of businesses. You'll encounter people who've never had a job. And so, again, you're going to have sort of a wide frame of reference of who and why. When we think about the where in rural homelessness, that's a really big question. There, like I said, there may be people who are sleeping in abandoned buildings or even just sleeping under a bridge in sort of the most populated area in the county or in the city. You'll also find people who are sleeping and living in their car or in abandoned cars. As you go out into really more rural areas, you'll find people, sometimes families, who are living in barns or abandoned homes, in mobile homes that no longer have electricity or running water. Anytime you see, if you're specifically doing street outreach and looking for people, what you would be looking for is any kind of building or structure or shelter that's abandoned. Most people who will look for a place where they can stay dry, where they can get off the ground. And so any kind of structure that provides that is a place where people could potentially live and stay. You may also find people who've made tents or who are living in tents, who've built structures. Those are all the kinds of places you would be looking for. When I'm in a really rural area, I look for trails, whether that look like a game trail or a place where the grass is beat down. A lot of times there'll be a lot of trash in an area where people are living and are homeless because they don't have garbage pickup, right? And so that can be a place where people may be living. And then how do people live like this? How do people live like this? And the question to that has a lot of answers too. The answer to that has a lot of different facets, but a lot of people will be very familiar with agencies that provide food and temporary shelter. They may receive food stamps or other government assistance. Some people really do live off the land. That's more rare to find, but that happens. People can access dumpsters or may access different trash receptacles. A lot of people who live in their car can live off of food stamps and then access, bathroom and running water in local businesses. But that too is a pretty basic, can have a lot of different answers. So let's talk about just the basics to remember when we're conducting street outreach, just the foundational things to remember. Number one, you are entering someone's home. This is probably the most important thing to remember. You can imagine if you walked out of the kitchen this morning holding your cup of coffee and there was someone standing in your living room, even if they looked really friendly, even if they had arms full of resources that would be helpful to you, you would probably not be happy, right? You would be appalled. So you are entering someone's home. You are entering the safe place that they've created for themselves. It may not appear safe to you. It may not even appear to be a structure, but you're entering someone's sacred space, and you've got to act that way. You've got to have a facial expression that doesn't reflect disgust and judgment and You may even need to practice that, but you're entering someone's home. And just because the way someone is living is unhealthy or non conventional does not necessarily mean that they're negligent or unsafe. We're going to talk more about that later. But you've really got to lay aside, these are the things that are essential for a place to be called a home. These are the things that are essential in order for me to respect you or to respect your space. I've been in structures that were crawling with roaches. I've been in structures um, that were damp, that were moldy, that smelled. I've been in many camps where you could smell that they were going to the bathroom very nearby. All of that, you've just got to prepare your face and prepare your voice and prepare your demeanor. That this, no matter how much it doesn't appeal to you, is where this person calls home, and to be able to lay a lot of your knee-jerk feelings about that aside. We also want to remember your resources, remember what you're there to offer. You're not there to tell them whether or not their place is clean or safe or anything like that. Keep in mind, what is it I'm here to offer? Why is it I'm here? Okay, why is it I'm walking into this space? And then to honor their boundaries. I visited a camp once. I had a young person with me, and we were just standing there talking to the person, and they were just kicking rocks. The young person with me, they were just kicking the rocks, laying all around the ground. There were rocks everywhere. And the person that we were there to visit stood up and said, "You know what? I spent 6 months building this fire pit so that I can cook things on it, so that it does what I need it to do. And I need you to stop kicking rocks into my stove." Um, that was something that never would have occurred to us. Oh my goodness, this is your stove. This is something you built and prepared. And just by kicking pebbles, we are violating that. Important to keep in mind. Boundaries. If someone says, "I don't want to talk to you," then what that means is you don't talk to them. Just because someone is living outside doesn't mean that they have lost the right to define their space. Just because someone is living in a way that you feel like may not be safe doesn't mean that they have to listen to you. No means no. If someone says go away, then you go away. And then probably one of the most important things to remember is there's what you can do and there's what you cannot do. And I mean that on a whole lot of different levels. Everyone that you visit, maybe almost everyone who really talks to you, may ask you to do something that you just can't do, whether that's for money or transportation or to use your phone. You need to walk into the camp, walk into these encounters as much as possible, knowing what you're comfortable with and what you're not comfortable with. If the reality is that you're not comfortable sitting on a stone over a fire pit 6 feet away from someone, then it's better to know that going in as much as possible. Are you comfortable with someone using your phone? We don't necessarily recommend that, especially right now with all of the emphasis on social distancing and PPE and things like that. But what are you comfortable with and what are you not comfortable with? And to be really clear on what are the services I'm here to provide and what am I not here to provide, and being really comfortable explaining that. So we're going to talk about street outreach before, during, and after. Before, during, and after. So before street outreach, I'm getting ready to go. It's really helpful to know, how do I present? This is something a lot of people don't think about. It's super important. How do I present? When I am walking up to someone's car, when I am walking up to someone's tent, who do they think is approaching them? Now, we're going to talk about what you say and what you do, but if all they do is see me, if they see me coming, who do they think is walking towards them? So I've gone on street outreach I went on street outreach with a big guy, and he always wore black cargo pants, and he filled the cargo pants up, the pockets, with things that were helpful. Great idea. No reason not to do that. And then he would wear a gray t-shirt. Very nondescript. Very good. No reason not to do that. But when he walked up to a car or to a person, he presented as a police officer. He looked very official. He looked like he had lots of equipment. He looked very intimidating. If you go in camo, there's a good chance that people are going to see you coming and think that you're a ranger, or think that you're a hunter, or think that maybe you're the landowner, right? All of that's very important to realize. When I walk up to someone, I have many times had someone yell out their window to me or yell out their tent to me, "I already go to church," or "I'm not interested in your VBS," or something like that. I think I sort of present as someone who's coming to tell you about Jesus or someone who's coming to invite you to church. I used to carry a big brown bag on my shoulder, and I would walk in with a clipboard when I did home visits or street outreach. And many times I had people say to me, You're not taking my kids away. Even before I got close enough to talk to them, they would say that to me because I presented as a social worker. I presented as someone who could be from the Department of Children's Services. Now, I didn't make drastic changes to my appearance. I did stop carrying the clipboard and the big bag. I'm not asking you to make drastic changes to your appearance. All I'm asking is that you be aware. Who do people think you are? How do you look at first glance? Because that's really going to determine how people respond to you. And do you need to mitigate that? Do you need to say, I'm not here to hurt you. I'm here, do you need to do something to de-emphasize that? Or is it something you can take advantage of? I can come across very compassionate, very kind of motherly. That works to my advantage in a lot of situations. So, how do you present? And putting that in mind when you consider your clothing, when you consider your vehicle. Does your vehicle look like a police car or a ranger's vehicle? In your whole presentation, how do you present? So you need to consider what you're going to wear, what you're going to drive. You want to wear something that's washable or even disposable, and even your car. After I step out of an encounter, I've got to get back in my car. And so can my car be cleaned? Can I sit on a sheet or something that can be thrown away? I really try to go and not look intimidating and not look like I'm afraid of you. I don't tuck my pants into my socks or things like that. But you may feel more comfortable doing that. With everything that we're saying today, and this is really important, with everything that I'm saying today, I'm not telling you what to do or not do. You've got to decide, as we said in the last slide, what you can do and what you can't do. And so if you don't feel safe unless you've got shoe protectors on and your pants tucked into your socks, then that's what you need to do. But just keep in mind, this is how this may make people feel, and what can I do to mitigate that? So everything washable or disposable, not just with COVID-19, but when I think about lice or scabies or bed bugs, those are actually things I'm much more aware of. I have long hair. I usually wear my hair up, things like that. Keep all of that in mind. What do I want to bring with me? We're going to talk about PPE. You'll probably have supplies that are suggested to you or that have been given to you by the Tennessee Valley Coalition for the Homeless. You want to make sure you have those with you. You might even just keep those in the car so that you have them with you if you encounter someone that you want to be able to help, but it's not an actual street outreach day for you. Any printed materials, I'm always careful about giving out too many printed materials because they don't usually have access to a trash can and they just end up all over the place. But certainly having what's been suggested to me to give. And there are printed materials specific around COVID that can be really helpful to people that you may have access to. I always take a pen and paper. I don't want to have to try to take notes on my phone. I try not to even get out my phone. That's just what I do. So I take pen and paper, and I take pen and paper that would allow me to write down something and give it to someone else, not just a notebook or journal that I keep with me. And then I try to be really up to date on local resources. Where are places where people can go? What are dentists? What are clinics, what are food, all kinds of resources, not just resources specific to COVID, so that I can be helpful in a variety of ways if possible. So when you think about PPE, of course, there are pages and pages of information on the CDC website that you can read about PPE. I've tried to make this really practical. When I go out, I try to make this really practical. What do I feel comfortable doing? You may do 100 times more than this, but what I try to model when I go into a camp or when I'm encountering other people is I try to model PPE that they could also do. So in other words, I don't want people to see me and think I need all of those things in order to be safe. So I don't wear a face shield. I don't wear an expensive respirator. I don't wear a gown because I think that, first of all, can create panic. And I also think that people may look at me and think if I don't have all those things, I'm not really safe. And I, first of all, don't think that's true, personally. And then I don't want to communicate that message. So what we're really primarily talking about are gloves and masks. You can certainly wear a different pair of gloves with every encounter if you have that amount of gloves. I don't think we'll be able to supply that large of a number of gloves, but you can certainly do that. But gloves, just like your hands, can be washed and they can be sanitized using hand sanitizer. So you can certainly just wash them between encounters as long as they're not ripped. When you think about masks, you can wear a homemade mask. Fabric masks, according to the CDC, can be washed in the washing machine, and that is considered a perfectly legitimate way of keeping them sanitary. You can also wear disposable masks. The problem with masks is that of course, what we suggest is that you don't even put on the mask until you're fairly close, maybe within 10, 12 feet of the camp or of the individual. It just makes it very difficult for you to be understood. And I want to make sure as I'm approaching a camp or as I'm approaching an individual, that they know who I am and why I'm coming. We're going to talk about that in a minute, but I don't want them, wait a minute, here comes someone toward me in a mask and I can't understand what they're saying. I think that creates a very frightening situation. So I would keep my mask down, and then as I approach the person within 6 to 10 feet, then put it up. And this again is you're going to have to decide what you're comfortable with. If you're talking to someone who's hearing impaired for whatever reason, and they can't understand you, you're going to have to decide, do I pull my mask down or not? There's no value in just adding confusion and frustration to someone because they just can't understand me. So that's a personal decision you'll have to make. But continuing to stay 6 to 10 feet apart, and then the mask. And then shoes and boots are an important part of your PPE, really. As you know, the virus is not airborne, and so a lot of just talking, my own talking and the people talking to me, the germs just fall straight down. And so I need to wear shoes and boots that can be washed, that can be cleaned. And even just when I work with people in general, I typically try to wear shoes and boots that protect my feet, so that if I have an open cut or something like that, I'm not exacerbating all of that. So lots that we could say about PPE. That's what I'm going to kind of hit the highlights there. You decide based on the information that you have whether you want to do more or less than that. But we recommend gloves and masks as you go out, primarily for the protection of others, honestly. Certainly to protect yourself. But the reality is most of us have been exposed to more people than those that we will be encountering. So I have 4 teenage children living at home. Yes. So they've been in and out, I've been in and out. I've been going to work. I've been going to the grocery store. I will have had more exposure to and more potential exposure to people who are sick than anyone I encounter living in an abandoned trailer in the woods. And so I'm primarily protecting them from me. So while I really may feel very comfortable not wearing a mask and not wearing gloves, I have to keep in mind, but do I need to wear those things to protect the other person? So you take into consideration your personal view on those things, your personal conviction on those things, and you act accordingly. We're recommending gloves and masks. So that was before street outreach, now during street outreach. So I know whatever that looks like for you. Am I going to pick a day that I go? Am I going to go with a friend? Typically with street outreach, we always recommend that you take someone else with you. That's a little bit harder now. If social distancing is really important to you, you may not feel comfortable having someone in the car. That's up to you, but in general, when I've done trainings on street outreach, we would always say take someone with you. At the very least, you would need to let someone know where you're going, exactly where you're going, but typically would say don't go alone. So I've got someone with me. Ideally, I know how I present. I've got the stuff I want to take. I've kind of run through it in my mind, everything we've talked about. So I'm coming up to a car where someone is sleeping, or I'm coming up to a tent. I'm coming up to an abandoned, mobile home, whatever. The very first thing I want to do, long before they see me, I want them to hear me. Long before they see me, I want them to hear me. So I just yell out, outreach. That's the word I yell out. I don't yell out my name. That doesn't do any good. They don't know me. I don't yell out my agency. I don't want them to have to process, is that an agency that I feel is safe? Based on that agency's name, what are they probably going to do to me? Outreach. That's what I yell out. That's very clear. Most people who are experiencing homelessness are going to know what that means. Outreach. I'm here to help. I continue to say outreach until I make eye contact with the person. Okay? And so if I never make eye contact with the person, I don't do any more than that. I may decide whether or not I just want to leave materials, but until I've made eye contact with that person, I don't say anything else. So if they're in their car asleep and they never wake up and look at me, I don't do anything else. I don't come any closer. Okay? I don't knock on the door. I don't knock on the car. I don't scream anything else. I certainly don't unzip a tent. I don't knock on a door even. I don't do any of that. I yell the word outreach, and if I don't make eye contact with someone, or if they don't respond to me verbally, then I don't go any further. If their verbal response to me is go away, I don't want to talk to you, get off my property, anything like that, then I honor their request. I am honoring their boundaries at all times. Okay, just going to leave this stuff right here, no problem, and I back away. That's what I do, and I decide whether I want to leave stuff or not. So if I come to a tent that looks, I say outreach over and over, and no one ever says anything, and no one ever makes eye contact with me, that's all I do. I decide whether I want to leave materials, but that's all I do. You'll come across, when you do street outreach, you'll come across campsites that have been abandoned, And so in general, if the tent looks like it would not keep the rain out, then I tend to assume that that's probably been abandoned, and I don't leave resources. That's the kind of gauge that I use to determine whether or not a camp has been abandoned. Does it look like it's waterproof? If not, probably no one's staying there. That doesn't always work, but that's a pretty good gauge. If it looks like, nope, that looks like it's pretty much waterproof, I think someone could still be staying there, then I may still leave materials or I may still leave supplies. That's kind of your judgment call to make. You're certainly not obligated to leave anything at all, and it may just be littering, really, if you do. So that's your call to make. But I announce outreach, the person gives some sort of verbal response, or they make eye contact with me, and that's when I explain who I am and why I'm coming. My name's Cindy. I'm with the Tennessee Valley Coalition for the Homeless. Just want to check on you guys, and I've got a few supplies if that would be helpful. Okay? You're probably not going to have the supplies that they most want. Let's just be honest about it. Most people aren't going to be ecstatic to see that you've got a hand washing bucket or that you've got information on COVID-19. So, no, I'm sorry, I don't have that. No, I don't have any water. This is what I've got today. We're just really checking on people, making sure everyone's doing okay, and trying to make it easier for people to wash their hands and things because of COVID-19, because of coronavirus. COVID-19 has become almost as popular as coronavirus, but probably coronavirus, honestly, would be a better phrase to use. What's coronavirus? If they don't know what that is, just been a lot of people sick with coughing, fever. We're just checking on people. Here's what you don't want to do. What you don't want to do, just like you would not do this in someone's home, is come in and say, I'm here to enforce social distancing. However it is you would say that. All right, you guys are way too close together. We got a lot of people who are sick out here. You need to spread out. You need to put your masks on. You don't want to do that. What you don't want to do is create paranoia, create panic, is create crisis. What you don't want to do is make people feel unsafe where they are. What's happened in a lot of street outreach around COVID-19 is people have gone into camps and they've done just that. And as a result, people have left the camp and they have gone to places that are not as safe for them. They've left the camp and gone to the ER. And so suddenly you've got a camp of 25 or 100 people who are all sitting outside the ER because the outreach worker made them feel like they weren't safe anymore or made them feel like they're all probably sick. That's a disaster. They're much safer in the camp. The CDC has even said, don't empty out camps. They're probably safer in the camp. So you don't want to do anything that makes them feel like I need to rush into a populated area and expose myself to COVID-19 or to anything else. So we're going to remain calm and professional. Here to check on everyone. I've got a few supplies and resources. Just want to make sure everyone's doing okay. That's all you really have to say. You don't have to do a COVID-19 training. You don't have to do anything like that. If they're not sick, then there's no issue, right? If they go into town, they're going to be made. It's going to be really clear to them really soon that social distancing is a thing, right? You don't have to explain all that. What you're there to do is make sure everyone's okay in regard to their health, in regard specifically to COVID-19, and then got this stuff for you. Just trying to make it easier for you guys to stay clean. Well, I don't want that. I wanted this. Okay, that's fine. Then we'll just take it back, right? Respecting boundaries, calm and professional. What is it I'm there to offer? I offer that, right? Respecting boundaries the whole time. Calm, professional. Calm is probably the most important thing you can kind of keep running in your mind. No matter what I see, no matter what I encounter, I'm going to be okay. This is what I'm here to do. I'm going to do that. So you have a flow chart that will be provided to you by the Tennessee Valley Coalition for the Homeless. I'm not going to go through the details of that chart. I think it's excellent. I think it's self-explanatory, and I think you'll probably have other training sessions where it's explained to you in more detail if needed. The spirit of what we're doing here, the spirit of the chart, the spirit of what we're doing here is we want to make sure that people are safe, right? We want to make sure that there aren't people dying alone. That's a big part of what we want to do. We want to let people know these are the resources these are the resources available to you if you get really sick. Okay, that's what we're really saying. These are the resources available to you if you get really sick. And here are some simple things you can do to keep from getting sick. That's what we're doing. And so if you see someone who is sick or wants to be tested, you can use the chart there to determine what to do. It's a little unknown to us. Will every health department or every hospital be willing to test people? Initially, people could only be tested if they had a fever and a cough. And so if you didn't have those symptoms, you couldn't be tested. Some counties may still be operating that way. Not every county has a hospital in rural parts of East Tennessee. Not every health department is the same by any stretch of the imagination. So we're not real sure who will be able to do what. That's where we want to just be able to say, here are your options. So we cannot provide a flow chart that absolutely says this will lead to this will lead to this. The spirit of what we're doing is these are the resources available to you. We want to help you stay well, and we want to help you find what you need if you're sick or if you feel like you need to be tested. We're respecting personal choice in this. We're not making decisions for anyone. We're not taking over anything. We're just offering just that. So given the resources that are available, what would you like to do? So if someone wants to be tested, what you're going to help them do is brainstorm, okay, here's where the health department is. What do you want to do? We're not transporting people. You certainly can't call 911 and be transported for testing. That doesn't happen. There's no one you can call and be transported for testing. So what would you like to do? Do you have a mode of transportation? What does that look like as we brainstorm with that person? If someone's sick, but it's not life-threatening, okay, well, there's this hospital, or there's this health department, or there's this clinic. How do you normally find transportation? How do you get to the grocery store is what I usually ask people. Is there someone who's willing to drive you? Do you want to just try to walk? Transportation, unfortunately, is not a problem that we can solve instantly. Would you like me to go back to the clinic and let them know that you're here and see if they can help? Would you like to call the clinic? Again, on your own phone. We're not necessarily advocating that you let other people use your phone, but here's the resources that are available. What would you like to do? I realize that in saying that, that means you may, to be honest, COVID-19 has been very rare among the homeless in Tennessee in general. It's very rare among the homeless in East Tennessee. There are counties that you'll go into that there have not been any reported cases of COVID-19. So we're not expecting you to find dozens even of people who have COVID-19. We're not expecting that at all. So I'm hoping that this is an encounter that you won't even have, but we don't know. That's why we're checking on people. So if you do find someone who's sick, we realize that by the nature of the flow chart and by the nature of the training, that what we're potentially saying is you may find someone who's sick and you have to say to them, wow, we didn't come up with any way for you to get to transportation. Let me go back and talk to the health department, talk to people. You brainstorm on your end. You may be walking away from someone who's sick. And I realize that's very difficult. You will not just be walking away from someone who's in a life-threatening situation because you'll call 911. You may have to walk away from some people who really, really want to be tested, or from some people who don't feel well and are afraid that they have it, but it's not life-threatening. And so we realize that is difficult. We're asking you to do a difficult thing right there. Unfortunately, we're just like you, just like the person that you're talking to in the camp, we're having to make the best of the resources available to us. And that's what we're really trying to do, is how can we help that person make the best of the resources available. So when to call 911? As always, when to call 911 is the same as it always is. That hasn't changed. You call 911 if someone's in a life-threatening emergency. Specific to COVID, that would mean that they are having difficulty breathing. I can see the muscles in their neck strain as they take a breath. I can see the strain in their chest. I can see their chest go up and down. I can hear them. They can't talk. They're having difficulty speaking. They can't breathe in certain positions. All of those things. Their color is very poor. Their blush or their lips are blue or seem to be losing some coloration there. All of those things. If you have a knee-jerk feeling, we need to call 911. Then call 911. But in general, you're going to use the same criteria that you would any other day in any other situation. You call 911 if you feel like someone's life is in jeopardy, or if you feel like they're a danger to themselves or others. That's a very broad statement. But if you meet someone and for any situation you think this person could really hurt someone. This person, as I approached the camp, they yelled at me and they had a gun. Well, that's tricky, isn't it? So do you think they're a danger to themselves or others? They fired a shot at me. I don't think you're going to have that happen, but if you do, you may need to call 911. That would be a good thing to get back in the car and call the Tennessee Valley Coalition for the Homeless and think, okay, what are we going to do? But if you're in any situation and you believe that person is a danger to themselves or others, then you're going to call 911. If you've never called 911 before, then let's talk a little bit about what happens when you call 911. The very first thing they're going to ask you is, where are you? And so in street outreach, that can be a little tricky. I have suddenly realized, oh, I don't know where I am. I'm in the woods somewhere, right? I think I'm maybe half a mile behind That's a very awkward situation to call 911 and realize I don't have any idea where I am. So it's important to realize, to keep in mind the entire time you're doing outreach, where am I? What are the landmarks? What are the roads? Every time I turn down a dirt road, okay, this road doesn't have a sign. Where am I now? Be aware of where you are. And then they're going to ask for the nature of the emergency. And this is where a lot of 911 calls in working with the homeless go awry, because they are going to respond to the situation that you describe. So it is important to stay calm and to describe the situation exactly as you see it. I'm with someone. I am behind the abandoned Walmart on Smith Springs Road. I'm at a camp in front of a blue tent. You'll see me waving my arms, and I'm with someone who seems to be having difficulty breathing. Or, I don't know, I'm somewhere behind that old Walmart. I can't remember the road, and someone ain't breathing right, and there are 50 homeless people here, and I think half of these people are crazy, and I think about half of them have got drugs everywhere, and there's empty bottles everywhere, and I don't know what's going to happen. This guy's not even breathing. Okay, same situation, but in the second call, the dispatcher is going to have to respond and is going to have to send people to respond, first of all, to people using drugs, um, and to what I've just described as 50 crazy people, right? To potentially 50 unstable people. So it is very important that you describe the situation exactly as it is. I could give many stories of 911 calls that just absolutely drastically affected the lives of dozens or scores of people who didn't even need to be involved because of the way the situation was described. You need to be accessible. As much as possible, the person that's going to receive the services needs to get up to the main road or needs to be somewhere where EMTs can access them easily. If you're in the middle of a camp, EMTs can drive the ambulance over tents through the camp to get to where you are. And so we want to avoid that happening, right? We want to disrupt as little as possible. So if possible, and it may not be, get that person to where they are easily accessible. They are going to ask you to stay on the line. So if you call 911 and they say, there are counties in Tennessee where, you have to get to the county line, or where the ambulance is going to be, an hour and a half away, they will very often expect you to stay on the line until EMTs arrive. So the idea of I'm going to call 911, I'm going to come back and check on you or something like that is probably unrealistic. Every time you call 911, the police can come. That's not something that would probably bother many of us. It's something that can be extremely disruptive for someone who's homeless, or for a community of people who are living together who are homeless. So you don't get to call 911 and say, hey, don't send the police, I just need an ambulance. You don't get to do that. You can request an ambulance and they can send 10 police officers if they want to. And honestly, when we're talking about people who are homeless, they very often do send the police. So for that reason, I try to you can imagine being a camp where there are 12 tents, maybe 25 people, and you've called 911 and not told anyone. And what happens in that camp when the sirens start pouring in? Absolute chaos. So I tell the person I'm very concerned about you. I'm going to call 911. And then I tell people around, I've called 911. EMT first responders are coming. And that way everyone's prepared. And if there are people who want to leave, they leave before the police arrive. And then what should the patient take with them, especially if someone's not able to think clearly? I try to say, do you want to take your purse? Do you want to take your wallet? Do you have medication here that you want to take to gather their things, or to allow them to gather their things? And then I provide applicable contact information. If I'm working with Bob and Bob goes to the hospital in an ambulance and I think, okay, I'll just call the hospital later and check on Bob, there's a good chance that I'll call the hospital later and they'll say, we cannot confirm or deny that Bob is a patient here. You may completely lose contact with that person once they go in the ambulance. And so giving that person your contact information, or the contact information for the Tennessee Valley Coalition for the Homeless, may be the only way they're able to get back in touch with you. Do not assume you'll be able to contact them. Okay, and you may think, okay, I don't want to call 911, but I do feel like we need to call Child or Adult Protective Services. Maybe maybe someone needs to come and do a wellness check later. I'm very concerned that this person's going to overdose, or I'm very concerned that this person's going to go into withdrawal and die. I'm very concerned about something like that. It's not a 911 situation, but I definitely think one of these other agencies may need to be involved. I would highly encourage you to talk about that with the Tennessee Valley Coalition for the Homeless. Of course, if you feel that you need to report something, report it. And I'm certainly not telling you not to do that. But I would recommend if possible, to sort of debrief that with someone for the Tennessee Valley Coalition for the Homeless. If this kind of work is new to you, you may be really surprised what kind of situations are not considered child abuse or neglect. And I've worked with people who saw a child living in a car and decided they should call DCS and really disrupted that family's life unnecessarily, because living in a car or even living under bridge is not necessarily considered abuse or neglect. It is possible for parents to take good care of their children or adequate care of their children in a variety of situations that are far from ideal. And then Adult Protective Services doesn't intervene unless someone is truly a danger to themselves or others. So all kinds of things we could talk about with that. All that to say, I would encourage you to debrief with someone at Tennessee Valley Coalition for the Homeless before you engage in any of these other services. As we've said, you're going to encounter a lot of people with a lot of needs that you can't meet. And so my go-to question in a lot of these situations is, how can I help? You may not even feel like that's the best question. In a lot of situations, all you can do is listen. And so you may listen to someone and find that you're not able to help with that at all. And that's going to be an important part of street outreach, is recognizing that. So, okay, I understand that. How can I help? What would you like me to do? Okay, I can do that. Or, you know what? I really can't do that. I'm not allowed to do that, or that's really not part of my job here. But that does sound really rough. I completely understand. I'm so sorry I'm not able to be helpful like that. It was really nice to meet you today. I hope the stuff we've provided is helpful. That's really the best of what we can offer today. I do hope we'll be back through, and I'm going to give a lot of thought to the things that you need. But being able to know this is what I'm going to say in these situations, where really being very comfortable knowing you're not going to be able to solve everyone's problems or even anywhere close. I can offer to help and then figure out, okay, based on their answer, what can I do and what can I not do? Okay, after outreach. An important thing to do as quickly as possible after an encounter is to document. Where was I? How many people were there? What were the medical concerns? What were the issues we discussed? And ideally, what kind of follow-up is needed? You certainly can't go to any agency and say, hey, this kind of follow-up has to happen. We're all just working with the resources we have. But ideally, this is the kind of follow-up that would be helpful. I try to write all of that out as soon as possible. Even if I go somewhere that's abandoned, I still write all that out. I went to this place, no one there, pretty sure the tent's abandoned, then I write that out as well. And then the Tennessee Valley Coalition for the Homeless will have a way that you can document that you can turn that information into them. I even write down the day that I went and the time that I went and how much time I spent there. A lot of agencies find that level of description really helpful in their record keeping and as they're even reporting to funders and other agencies. Then you want to remove, before you get in your car and write ideally, but at some point you want to remove your personal protection equipment. We've talked about how you can determine how long you're going to wear all of that. But if I've decided I'm going to dispose of my gloves, then I want to do that. And I certainly do not want to just throw those on the ground outside the camp. Remember, I'm respecting space, and that's typically illegal anyway. When I get back home, ideally, but this may not be practical, I want to remove everything that I'm wearing. Do not shake it out. You don't want to do that. You don't want to make things airborne. I want to remove what I'm wearing and then roll it up and put it straight into the washing machine, or put it into a garbage bag and then carry it to the washing machine. If I take off all the clothes that I'm wearing and then put on clean clothes and then pick up the dirty clothes and take them to the washing machine, then I've probably defeated the purpose of taking them off. So I want to take everything off, put it in a bag or put it in the washing machine and wash all of that in warm water. If there's something like my wristwatch or my shoes that I cannot put in the washing machine, I want to leave those out for 24 hours. Certainly things like your shoes you could wipe off, you could sanitize, even things like your watch. But I want to think through my whole person and wash, sanitize, or isolate everything that I took with me, including my purse, things like that, anything that came in contact with the environment. I do this anyway, even without the COVID-19 concerns, because of things like lice or scabies or things like that. I really do that anyway, and then just take, and then wash myself, take a really good shower and do all of that too. And then lastly, I debrief. And I don't necessarily mean that with someone official, but I talk through my experiences with someone that I trust. Not necessarily anyone who knows anything about homelessness, but I talk through. These are the people I've met. This is how it made me feel. This is where I felt inadequate, or I felt ashamed, or I felt guilty, or I felt excited, or I felt hopeful. I talk through that with someone, and I would highly encourage you to do that as well. It can be very unhealthy to encounter people in crisis and then just kind of try not to think about it anymore, or assume that that doesn't have any impact on you, or whatever. There can be a lot of unhealthy ways that outreach workers respond or try not to respond to what they've encountered. So I try to debrief, not with my 10-year-old, but with someone who can handle it, with someone who can talk through that with me and isn't going to be traumatized as a result of our conversation. I would encourage you to do that as well. And then lastly, do not underestimate the value of your encounter. Um, there are people that you will sit and listen to. You may not be able to help at all. You may not be able to help at all, but you listen to them. Some of the people that you encounter have not had a compassionate conversation with another human being in months. You have the opportunity to do that. I have had people come into the clinic where I worked when I worked in a clinic, who threatened outreach workers, who threw things at outreach workers, but they eventually came to the clinic because they knew that outreach worker cared about me. The outreach worker never knew that. They never knew the person who yelled profanities at you was actually impacted just by the fact that you walked all the way back to their camp and yelled outreach 3 or 4 weeks in a row. So so have that perspective as you complete your outreach, each outreach encounter. If you're going in with a heart of compassion and the desire to help, all the different ways we could describe that, that alone speaks value and worth and care to someone, whether they show it or not, and that has value. And so do not determine whether or not your outreach encounters have been valuable based on whether or not someone got everything that they need. The very fact that you're interacting with someone is valuable in and of itself. All right, there will be other resources available to you through the Tennessee Valley Coalition for the Homeless. They also have all of my contact information, and we are working very closely together on this endeavor. And so please feel free, if there are questions you have for me or more information you have for me or just feedback, this worked, this didn't, this was awful, whatever, please do pass that along to them, and I would be really happy to hear from you. Thank you.